maybe kick our session off today. My colleagues here will continue to admit more attendees as they join us. My name is Elma Johnson. I am the coordinator of the BOLD Public Health Center of Excellence on Dementia Caregiving, and I'm so happy that you all are able to join us here. It will be a very special session. It's the 10th installment of our Public Health Roundtable series. And today we have invited our very own Minnesota BOLD program and one of our community partners to present. So that's just very brief introduction. I'm going to let them do most of the talking and the interaction later. But before we start, just a few notes. Next slide, please. Thank you. I also work, as you can see, at the University of Minnesota at our Center for Healthy Aging and Innovation, where I help coordinate our equity and community outreach efforts. Next slide. And before we start here at the U of M, we really want to ground ourselves first and acknowledge the land on which we do our work and work with our community, whether it's in a physical or virtual space, and acknowledge that it's located on traditional ancestral lands and contemporary lands of the indigenous people. And we acknowledge with gratitude the land itself and its people, and we take to heart to commit through action to learn and honor the traditional Dakota values: courage, wisdom, respect, and generosity. Thank you. Next slide. So I'm just from seeing the names, many of you, your names sound familiar. So many of you might be already familiar with our center, but just very briefly for those who are new, we are a CDC-funded center, and our role is to support public health departments at the state, local, and tribal communities with their programming to support dementia caregivers. As a dissemination center, our goal is to improve access to evidence-based programs, approaches that work and that have been shown to have positive outcomes for family caregivers of people who live with dementia. We also facilitate connections between public health departments and a variety of collaborators and community-based organizations in the space of caregiving. And we, thanks to our large center membership, we are able to provide really expert technical assistance and answer questions to support the work of our public health departments across the US. So that's in a nutshell. I invite you to scan the QR code and visit our website where you can learn a little bit more, or feel free to email us. There is also a contact us form there as well. Next slide, please. We are a part of Healthy Brain Initiative, HBI for short, collaborative, which is a national collaborative group of partners. All of us work together to really support the integration of dementia and cognitive health into public health practice. Learn more about who our partners are on our site. It is hbicollaborative.org. And again, feel free to reach out with any questions. Next slide. Before we begin, even this is a little odd, but we tried to put this up front. If you have a phone, please scan this code and have it available on your phone later, and tell us how you liked today's session. We will be dropping it in the chat, but we often exchange so many resources that the link to our evaluation form can get lost in the mix. But please tell us about your experience and what ideas you have for future events. We really, really appreciate it, and we do use that feedback to inform our center's programming. So thank you for that. Next slide, please. This is a bi-monthly series where we highlight the story of one state, one health department at a time. And this is an opportunity really for all of you, but especially for public health professionals to network and learn from one another. This is our space for building a community of practice for public health. Next slide. And just a few reminders to make this more interactive. You all know that we set these up as meetings, which please make it very important to mute yourselves, and feel free to turn your video on while the panelists are presenting, just so it can make it really, it can support all of our sense of participation. Please put your name and organization in Zoom, your Zoom name, And your questions, please. I think you should all have access to the chat. Please submit your questions. We will, at the end of today's session, we will have time for a Q&A and to answer some or if not all of your questions. Feel free to drop them in at any time. Yeah, and any comments, resources, links that you want to share with one another, please do so as well in the chat. And thank you for your feedback again. Next slide. I'm really flying through all of these because I want to save as much time as I can for our presenters today. Before we start all of our sessions, we want to know who all is in the room. So my colleague Ashley is going to start a poll. You will be invited to tell us in what capacity you're attending this event today. Are you a community member? Are you a person living with cognitive impairment or with dementia? Are you representing a public health department? Yeah, you should be seeing the poll right now on your screen. And thank you for answering. It also gives a good idea to our presenter who all is in the room, who we're speaking. My main audience, as I mentioned earlier, are public health departments, but really our events really draw a wide range of attendees from the community members, community-based organizations, etc. All right. I see most of you have responded. We'll just give it 5 more seconds and we can share our results on the screen. All right. I'm going to share results here. About 30%, a third of you are from community-based organizations, service providers working with people living with dementia and their caregivers and families. Thank you for your work. Then we also have a lot of our, just as many of public health departments represented here. So welcome to our bold family here today. All right. And very briefly, this is who you will be hearing from today. Patty Takawira and Maya are joining us from our Minnesota Bold public health program. And later we will be working with Betsy with one of our bold partner organizations, the Remember Project. We are so excited to have them today so they can host this session for you. Very briefly, Danette McCarthy is the founder of the Remember Project, and she's a co-founder of the Center for Creativity and Public Health. How cool does that sound? And Danette's passion and purpose is to use the arts and participatory leadership to help communities reimagine the future where everyone lives their lives to the fullest. And Betsy Meyer has spent 25 years in the field of healthcare administration before becoming the Director of Programs and Partnership Development for the Remember Project in 2021, where she joined her colleague, Danette. Welcome both. And next slide. As you listen, next you will be hearing from Patty from our BOLD program. And as you listen, we invite you to think about what are some of the areas of focus that you're hearing about from that our program here in Minnesota really stands out for. We have just highlighted building a diverse and skilled workforce and strengthening and mobilizing communities and partnerships as 2 areas of work, but really the work of our BOLD program is going to touch on each one of these essential public health services as you will hear soon. So at this point, I am going to hand it off to Patty and welcome everybody. Patty, thank you so much for being here.
Thank you, Alma. So I'm Patty Takawira, and I work at the Minnesota Department of Health in our Center for Health Promotion, leading our brain health and dementia work. And I'm really happy to be here today, especially with one of our key partners, the Remember Project. You can go to the next slide, Ashley. So I'm going to talk a little bit about our work at MDH, give an overview of caregivers in Minnesota, their health and well-being, how we've used data to guide our work, an overview of our MDH Healthy Brain Initiative and our key projects, and our specifically our MDH Healthy Brain Community Grants. And then you'll get to hear from the Remember Project and really see and hear how they engage community and caregivers through art. So Minnesota Caregivers, you can go to the next slide. This is just a slide that shares how we use these two terms interchangeably, caregivers and care partners. They can refer to these bullets. Care partners in particular kind of emphasizes this active participation in their own care for someone living with dementia or other people receiving care. So we use both of these terms. You'll see both of them. It kind of depends on the preference of the community or the organization. We're generally referring to unpaid, informal family, friend, and neighbor caregivers. Can go to the next slide. So I'm going to share some information about Minnesota caregivers, and our data sources are our Minnesota Behavioral Risk Factor Surveillance System, or BRFIS. Our public health audience is probably familiar with BRFIS. It's an annual telephone survey. And then we also are going to share some data from a partner survey that we designed and conducted with organizational partners in Minnesota. It was a landscape assessment, kind of an environmental scan to understand our existing dementia-related infrastructure and sort of the needs and interests of organizations that are working on dementia-related efforts. We did that through convenience and snowball sampling, and it reflects the work of 175 healthcare and social service organizations. So our data on caregivers through BRFIS, of course, it's self-identified through the question, during the past 30 days, did you provide regular care or assistance to a friend or family member who has a health problem or disability? So 1 in 6 Minnesota adults identified as being a caregiver with this definition. And of those, 1 in 8 reported being a caregiver for people living with dementia. And of course, this, again, it's a telephone survey. This data doesn't reflect all Minnesota caregivers, and there are different definitions of caregiver. So depending on how we define it, there may be different estimates. So this is really just one estimate. You can head to the next slide. So what do we know about Minnesota caregivers? We know that most are females between the ages of 45 and 64 years. Most are caring for a family member, so a parent, spouse, or a partner. And in particular, dementia caregivers are more likely to provide support for 5 years or more, to work 20 hours or more a week, and to provide personal care like bathing or dressing. And you'll have these slides so you can look deeper at the data presented on these slides, and I'll be moving pretty quickly just to make sure that we have time for Danette and Betsy to share their awesome work. We also know that Minnesota caregivers are more likely to be living with a chronic disease than non-caregivers, and dementia caregivers are even more likely to have at least one chronic disease. And you can see the comparison between Minnesota caregivers and non-caregivers in the table. It shares more about some specific chronic conditions. And Minnesota caregivers are also more likely to report having 14 or more poor mental health days per month than non-caregivers. And in addition, a history of depression and also current smoking. So smoking can be more of a coping strategy for when stress levels are higher, and it can be kind of a marker for challenges with coping with chronic conditions. So we find it really interesting that there's this higher smoking rate among Minnesota caregivers, as well as the poor mental health days and history of depression. And I should add, many of our Minnesota caregivers find their caregiving role extremely rewarding, but we know that it can come with some physical and and mental health challenges as well. Another really interesting finding looking at our Burfus data is this question around social and emotional support. So Minnesota caregivers are more likely to report that they sometimes, rarely, or never get the social and emotional support that they need compared to non-caregivers. And this is actually worse for Black or African American caregivers and other BIPOC groups. So they're reporting really a much higher rate of sometimes, rarely, or never receiving the emotional and social support that they need. I think this is a really important takeaway from looking at this data and really informs our caregiver health and well-being, the needed strategies. So this, moving into our environmental scan that we worked on with our statewide partners, we learned about what types of caregiver support and services our Minnesota service providers that are working in dementia efforts are providing. So about 78% are either currently providing services and supports for caregivers or plan to. And getting more into some of the specific types of services that they are providing. Many of them are offering caregiver education and support groups, and they're wanting to expand their types of services to include more messaging about caregiver health, evidence-based caregiver education programs, and programs to support disease self-management for the caregiver. So there's definitely interest among service providers to increase programming for caregivers, for dementia caregivers specifically, focus more on their health and well-being. So we see that coming through in our survey data. You can go to the next slide. And they also want to expand services to address mental health. This was another really kind of impactful finding for us.
Noodle shape. There's more too if you want it.
Yeah. If you're not muted, please mute yourself. So the organizations that are currently providing services are also more interested in expanding services to include more mental health, counseling, therapy, caregiver consulting services. It seems to be one of the biggest areas that they're interested in expanding to. So definitely some opportunity to support direct service providers. And we also asked some questions about implementation of whole person approaches. And to sort of get at that, we asked some questions around use of culturally responsive strategies and services, use of community health workers, and assessment of client social needs. So there's definitely, this is sort of kind of validates the direction of our MDH initiatives, which are very focused on culturally responsive strategies and services. We see quite a large opportunity to do more and provide more technical assistance to organizations in this area. And a fair amount are using community health workers in assessing client social needs, but definitely some opportunity to increase the use of those strategies and other whole person approaches. And I want to thank Renee Kidney, who I think is on the call. She's our epidemiologist, and she has been digging into this data for us and really just a total asset to both MDH and our Department of Human Services as we identify strategies and activities and tactics that are supportive of caregivers and dementia caregivers. So thank you to Renee for being our data guru. So I'm going to move into talking a little bit more about our MDH Healthy Brain Initiative. So our work is funded through the BOLD grant. We're in our second round of funding for 5 years. And We also, in the last legislative session, secured some funding to develop and promote culturally responsive messages through an Alzheimer's awareness campaign. And the Alzheimer's Association of Minnesota and North Dakota advocated for that funding. So the power of partnerships are apparent in our work, and we're really excited. We're kicking this work off this year. So it's great to have another source of funding beyond BOLD in our public health department for some public education. Go to the next slide. Elma mentioned that our work is aligned with the 10 essential public health services. She talked about the building a diverse and skilled workforce, as well as strengthening, supporting, and mobilizing communities and partnerships. And I think a big area of our work in the last 4 years or so has really been in that assessment area, trying to figure out what our dementia infrastructure looks like, needs, assets, and of course, equity is centered in our work, and culturally responsive strategies and community-led strategies as well. Our coalition, the Minnesota Healthy Brain Partnership, is an informal group that meets quarterly. The purpose is to really increase our communication and collaboration, identify strategic alignment and opportunities for collective action, and leverage our collective statewide resources to support implementation. Since we've begun meeting about maybe 2.5 years ago, this group has provided so much guidance and just shared implementation with MDH. They've provided guidance on our MDH Healthy Brain Community Grant Program. They helped us develop and disseminate our Minnesota Dementia Partners Survey, and helped us develop our dementia strategic plan. We are currently building out our strategic plan with activities and tactics through 2 work groups that most of the Minnesota Healthy Brain Partnership members participate in as well. So it's really been, we couldn't do our work without the folks that participate in this group. University of Minnesota and Center for Healthy Aging and Innovation, and the PICO on Dementia Caregiving being one of them. You can go to the next slide. The Dementia Strategic Plan for Minnesota is really built off of our shared priorities and also previous collective planning efforts. So we really did a crosswalk of state plans on aging and previous lists of recommendations presented to the Minnesota legislature, and also used our assessment data and community input to inform strategies. And we aligned the strategic plan areas with the Healthy Brain Initiative roadmap just to help with reporting and make sure that we're aligned with the national effort as well. Go to the next slide. Like I mentioned, we have 2 work groups. We have a community work group. Their key role right now is really helping to co-design the next round of our Healthy Brain Community Grant program and the activities that are going to be in that RFP. So this is really a community-led process. And then we have a data to action work group that has defined a purpose and scope for a Minnesota Dementia Dashboard. And they're currently in the process of identifying outcomes, measures, and indicators for what we are calling a low-tech but high-impact dementia dashboard. These are some of our key partnerships. Like I mentioned, Alzheimer's Association, I think in a call yesterday, they referred to themselves as making good trouble, the legislature, to advocate for more, whether it's respite or public information campaign. They're really working tirelessly to advocate for additional resources for Minnesota. Our Minnesota Leadership Council on Aging is supporting our work group, our Dementia Strategic Plan work groups, through participation from their Diverse Elders Coalition, the University of Minnesota, Center for Healthy Aging and Innovation, PICO on Dementia Caregiving, as well as the Minnesota North Star Geriatrics Workforce Enhancement Program are all key partners helping us promote tools and resources. And we have a really strong relationship with our Department of Human Services and our Minnesota Board on Aging. We have been working really closely to just figure out how our roles connect. We meet monthly. We're participating in each other's work groups. DHS currently has a Committed to Caregiving initiative with a few work groups where MDH is participating and providing some data support, and vice versa. So it's been really impactful, I think, to build a strong relationship across the two agencies and figure out where we can work better together. Can go to the next slide. We also have a broader age-friendly Minnesota Council that is currently working on a multi-sector blueprint. So this is a council of state agencies that are coming together to do sort of this big and sometimes seemingly impossible task of aligning efforts into 4 specific domains. They're at the stage where they have domains and strategies, and we are working to integrate our dementia strategic plan into this broader multi-sector blueprint. So as you can see on this slide, some of the strategies talk about age-friendly healthcare access, as well as support for family, friend, and neighbor caregiving. So we want to make sure that our strategies identified through community input are integrated into this overarching plan. And if you go to the next slide, I have a question for the audience, and feel free to share answers in the chat. How are you, especially the public health departments on the call, how are you aligning your ADRD or caregiver-focused strategic plans with broader healthy aging plans and frameworks in your state? So in Minnesota, we have a lot of aging work that is led by our Department of Human Services, and our health departments may be working on more specific work around, dementia or other chronic conditions. So what does this look like in your state? How are you embedding your work into those broader efforts? And I'll just pause for 30 seconds or so to let you provide any feedback in the chat.
Thank you, Patty. Well, folks put their answers in the chat. I typed it in there, but I just wanted to say that the Minnesota Department of Health has really been doing a great job trying to build the state coalition and really trying to find opportunities, any spaces for collaboration with DHS and our AAA network and all of the agent service network, which it has been really impressive. So thanks for the leadership to you, to Maya, and all of your team, to Renee, for bringing us all together.
Thank you so much.
Yeah.
It's also storming and raining really hard where I am, so I'm feeling slightly uneasy up in my attic today, my attic office.
Great. Montana is a new recipient of the Bull Grant. So yeah.
Congratulations, Montana.
Yeah, building that state those collaborations, those partnerships is like the first initial, but such an important step for any for any Department of Health, but it's specifically for our BOLD work. So Montana, as you build yours, maybe some of our colleagues here who have been with BOLD a little longer can share their work and lessons learned along the way.
Yes, we love connecting and learning from other BOLD grantees. Thank you, Oklahoma, for sharing. Wonderful. This is exactly the feedback that I wanted. Thank you. Well, keep sharing in the chat, and we can move ahead to the next slide, make sure we get time for the Remember Project. I just want to highlight some of our key initiatives. So this is not everything, but some of our big ones. So we're just kicking off the statewide Alzheimer's awareness campaign. And of course, with BOLD funding, we've been doing some public education, but this really allows us to create like a community toolbox of culturally responsive resources specifically in collaboration with our partners, and then promote them widely. So we're really excited. We are working on some CHW training modules for dementia, kind of spanning the levels of prevention. And those are going to be, they're currently being, we worked with our Community Health Worker Association to develop these modules, and they're being translated into Adobe Captivate to be shared through our MDH Learning Center, and then will be widely available after pilot phase. So stay tuned for those. I know other states are really interested in CHW training, maybe working on some similar things. So if so, let's stay in touch. We also have a really strong partnership with our Volunteers of America Culturally Responsive Caregiver Support and Dementia Services team from the very beginning of our Bold Grant work. They have a mobile memory clinic, and with support from MDH, they developed a new program as part of their virtual series called Brain Health, Know Your Risks. And I don't know if you can see very well, but there's this picture of a banner they created for when they're out tabling at events with the mobile unit. And it talks about brain health and healthy brain and healthy heart and how to minimize risks. So they've been, they provide services in all different places at all different times. And they're also, they're going to be working with, they are already working with barbershops and beauty salons to provide dementia education and training, both for like increasing awareness about signs and symptoms and supporting caregivers with referrals to services. And I look forward to sharing more about that over the next year as well. And then we also have our MDH Healthy Brain Community Grants. You can go to the next slide. So we have 4 grantees, and they've really been building their capacity in this space. In 2023, they were able to reach 3,821 people with, through different events with dementia education. These grants are really focused on culturally responsive dementia awareness, caregiver support, and you can find more information about each of these grantees at our website. Next slide. So our grantees got together last fall just to kind of reflect and share their work with one another. And it was really impactful to hear more about just why it's so important to work with community organizations on initiatives that are culturally tailored. So just, a quote from one of our partners, Centro Nazareno de Agape, that is providing training to pastors across 14 different Minnesota counties. They support 26 churches and even produced a new bi-monthly magazine really focused on healthy aging with education about dementia in Spanish. And one of the quotes from our grantee gathering was just that people feel at home in the church. It's an opportunity to feel safe talking about dementia. So, and if you go to the next slide, it's another quote from one of our partners that's working on building capacity in the African immigrant community. And our partners talked about how before we even talk about dementia caregiving, we have to make sure that the community knows what dementia is. And some communities don't have a word for dementia. And so it was just a good reminder that we have so much opportunity. We're really starting at the beginning and educating about dementia. You can move to the next slide. And one of our other partners, Northwoods Caregivers, put on a conference called Honoring Elder Wisdom. It was probably one of the most just authentic conferences I've ever been to. There was so much learning, caregiver panels, really just speaking from lived experience. And I think the University of Minnesota, PICO on dementia caregiving is really great at this too, but it's to really highlight people's actual experience providing care and the challenges and just rewards from that experience where were really helpful, and it was great to be there with them. Let's jump ahead. Yeah, so now we get to actually hear from one of our Healthy Brain Community grantees, and they are going to demonstrate what it looks like to use the arts to provide dementia awareness, including some group conversation. So thank you so much for letting me run through these slides pretty quickly. You'll have them available to you in case you want to go back and look at them. And we will have some time for questions after the Remember Project presents. So if there's anything, you can save it until after that or add it into the chat right now. Thank you so much.
Well, hi, everyone. I'm Danette McCarthy, and I am here today with my colleague and friend, Betsy Meyer. We're coming to you from St. Paul, Minnesota. Myself and Betsy is up at the headwaters of the Mississippi in Monaga, Minnesota. Some of you in the audience, I took a quick look down the list. Some of you know the Remember Project really well. Some of you have been hosts and presenters of this project, and we are very excited to see your names and hopefully your faces. And I bet many of you have no idea what we are and who we do. So that's our goal today, is to give you a pretty fast overview. You could slow down on the slides. That would be great. You're ahead of me a little bit, Ashley. Could you slow down the slides, please? Okay, I'm going to ignore the slides for a moment, and I think Ashley will. There we go. So this high-level summary we'd like to provide today is about the ways in which we envision using the arts to support the entire dementia-friendly communities movement. And then we're going to show you some excerpts from our theatrical videos. Our Remember Project partners get a chance to work with us as, we try to come to the table as thought leaders and artists, but also very pragmatic idealists. We work carefully with our partners and the organizations to address multiple outcomes. And all of these slides we're flipping through right now, to reduce fear, to increase awareness, to reduce stigma. We are very focused on addressing, whoa, I'm so sorry to be reacting to the slides. Ashley's gonna figure that all out.
Yes, I apologize. Give me one moment. They look to be on a timer of their own. So I'll get those pulled up in 1 second.
Okay, so again, I'm just going to talk about this incredible importance in using theater as a tool to invite audiences into an environment where they can look at and think about the people on the stage. They can talk about those people's stories, and that creates this invitation of their own to share their stories, to, no matter where they are on a dementia journey, whether they're coming to an event for the very first time to learn more, or they've been through an entire journey and lost someone, they're able to be there together in community, have a shared experience, and then spend time talking about it. So these conversations that open shed a great deal of light on isolation and loneliness that can be such a predictable part of the dementia journey for caregivers and the person with the diagnosis. Our program tries really mightily to stand with our partners to address risk factors. Long time ago, as a teaching artist in the 1990s, the Search Institute in Minneapolis helped me understand these two big categories: risk factors and protective factors. I knew as a teaching artist that I might not have much impact at all on the risk factors that people face, but that I could help address protective factors. And so those protective factors, including experiences with the arts to have meaningful conversation, have continued to guide me and my colleagues in our work to help us really talk openly about brain health and to help meet local and regional goals. We know that one size has never fit all, and it never will. And if one of our goals is to help people have less fear because they understand their resources and they can get into a memory screening and connect with their resources, then we've made a major step in this entire dementia-friendly communities movement. Far too often we hear that families are in crisis before they even know where their resources are. So some of you, again, who've hosted our programs, you know how important it is for us to be able to point our audiences in the direction of memory screenings and early detection. I'm almost done with the slide part, Ashley. I'm sure that was very frustrating. I'm sorry about that. You know, the impact of this work really relies on collaboration with community partners. And we've really witnessed the power of collaboration in every single program we've delivered. And we have delivered over 330 programs. We do that live with live actors in a in-person venue. We do that virtually with 100% virtual participation. And we also do that in a hybrid fashion where we might be on the ground with a virtual program being broadcast to viewing rooms and independent audience members everywhere. In fact, over 25 states have had audience members at our events and 2 international communities. We work, in addition to the gratitude we have in working with Minnesota Department of Health and this BOLD initiative, we are working with the state of Wisconsin and their BOLD grant as well, working with the Office of Deaf and Hard of Hearing. And a little bit later this summer, for the first time, we will have one of our plays presented by 2 deaf actors. And if you happen to be fortunate enough to be in that audience as a hearing audience member, the interpretation will be for you. We're also in early conversations with leadership in the state of Michigan to do more work in Michigan, which we were able to do some work there during the pandemic. This incredible impact is only possible with really sincere, serious partnerships, and it's something that we take very seriously. The next slide is just a still from the play that you're about to see, or a couple of stills. We don't believe for a second that becoming a dementia-friendly community is an easy thing. And that's mostly because of the fear and stigma. Most people really avoid this topic as long as they can. And I laugh because I'm one of them, right? It's just like it took me being involved in this project in 2015 to really become clear about my role in making all communities dementia-friendly. Watching a play together is really impactful, and it is that conversation after the play, the community conversation, where the real impact is. At every single event we've ever facilitated, there is personal disclosure that happens, there's recommendations made, there's moments of aha, and there's authentic connecting that happens in the community conversation. So even though it's going to be a little bit short today, you're going to get that experience in just a moment. The other thing I want to share is that we are not experts. We've learned a lot along the way on the topic of dementia. In every single event we do, we have subject matter experts in the room ready for the handoff. You know, sometimes we can answer a simple question an audience member might have, but whenever possible, we hand it off to a dementia care specialist, a public health official, somebody in the world of dementia education, so that question can be answered by a local resource. We know how powerful this tool is for inviting people into a conversation. We thank you for your interest. And now we're going to get ready to look at some video excerpts from our play, Steering into the Skid. All this information will be available to you. We are recording the whole thing because we're not seeing the entire play, so that you will be able to connect with us and connect with the whole play in a different way. This play, by the way, was written by a husband and wife team, Arnie Johnson and Deborah Percy. It's a really interesting structure. We watch one couple over the course of one whole year with one scene in each month from one New Year's Eve to the next. And during that time, the first 3 or 4 months, the audience probably doesn't even know which member of this husband-wife team might be dealing with a cognitive change. By the late spring, we understand that it is Tim that is dealing with dementia. And what you're going to see today is excerpts starting in July through November to give you an example of what this family care partner, what Amanda is going through as she recognizes that their life is really changing. So again, these excerpts, Betsy's going to bring it up here in just a moment. Betsy, let me know when you're ready. These excerpts are from the play Steering into the Skid. They are collected in an anthology called the Memory Care Plays. And we are very pleased that this play has been part of our repertoire. And soon there will be 6 plays since 2015. So Betsy, are you ready?
We're all set.
Great. We're going to turn it over to you. And then right after, we're going to dive into a quick community conversation, just so you see what that's like. Go for it. Why didn't you just leave that in the mailbox until we got back?
Oh, I thought you might want something to read as we go along the way.
Well, we are only going to the shoe store to replace your brown loafers. Maybe stop and get a birthday gift for Jake along the way.
Those loafers were my favorite. I mean, who loses a shoe?
Oh, it must have fallen out of the car at the golf course. That's when you missed it.
Well, now it's just gone. It's plain stupid.
Well, we will find you an identical pair. You know what? This is all just junk mail. It's credit card offers and insurance things. I mean, they all want to sell me supplemental Medicare insurance, and I am not even retired yet.
Yeah, they sent me the same crap when I retired. You know, those loafers were broken in just right.
Just like me. And look, there's one from AARP. I thought they were on our side.
My side? You're still out doing appraisals every day. When are you going to retire?
Well, we have to pay for things, you know, like that flat screen in Florida.
You know, they send all that stuff and they talk about a vigorous old age and they show people that are fit and tanned and playing tennis. But they think we need protection. It's a protection racket.
Let's not get old.
I feel fine.
August.
August.
Oh, it's Jake. Hi, honey, how are you? And how is our August birthday girl? Did she like the princess doll? Yes, we did. Our appointment was at 10.
Which means I had to get up way too early.
Yeah, we're on our way home now. No, not really. But who really likes a new doctor at first, anyway? No, I don't know anything yet about the cost, but this guy, oh my gosh, he is an expert in the...
She's sending me to an expensive specialist because I lost a shoe. And because I don't or I can't unload the dishwasher.
Listen, honey, can I give you a call when we get home? Cell phone to cell phone is really hard to hear.
It's too easy for me to hear.
Oh, I love you too. Please give the girls a big hug for us, okay? We'll give you a call when I get home, in about an hour or
When
so.
I'm not around to hear.
Tim, sweetheart.
I don't like any of this.
Well, I don't like it either. I don't.
Well, then let's get away. Let's go away to Florida. We could see the tigers at
Lakeland.
I'll bet this damn RPM could get us there.
It is a GPS.
GPS.
We really did have a lovely time, though, didn't we? You know, walking on the beach together and eating grouper bites.
Lovely time? Grouper bites?
Yes, in Florida.
Oh, right, in Florida.
September.
Is it Winfield's?
Yes. Libby's favorite place. Ours too, remember?
Of course I remember.
Oh, and I DVR'd the Tigers game so you can watch it when we get home.
Hitting, pitching, fielding, that's good work, Mandy.
You can watch it when we get home from dinner.
At Winfield's?
Yes, with Libby.
I don't understand why she even wants me along.
Oh, well, we come as a set, don't we? Besides, she could use the moral support.
Well, who gets divorced in their 60s?
Well, everyone has their limit, I guess. But she has rediscovered her sex drive.
Well, what about Lyle?
He has rediscovered the chemically enhanced redhead.
Well, I guess he must have found his Viagra.
Oh, Tim. did you take your pills?
Viagra?
Tim, you know what I mean.
No, I forgot. I'll wash them down with champagne at
At Winfield's. Turn here, right here. October. Tim, roll down the window. The button is right there. Roll down the window. What are you doing sitting out here in the driveway?
the driveway.
Yes, the driveway.
Mandy, I couldn't find the golf course.
Tim, sweetie, it's in the GPS, in favorites.
No, I turned that on and she wouldn't say a word, not snotty or otherwise.
Well, she's not going to say anything until you tell her where you want to go.
I had no idea where I was, so I just drove around, and then I recognized our mailbox.
Well, listen, why don't you come on in and have some lunch?
Oat squares? Have we got oat squares?
It is just too cold for golf anyway. Come on in, Buster. November.
What's this guy's name again, this twerp?
It's Dr. Antwerp.
There, see, I told you, I knew he was some kind of a twerp.
And he thinks so well of you.
Tell me this, Mandy, when are you going to retire? We had this all planned out.
Plans change, buddy. It feels a little crummy just to like give you most of the middle of the play. But again, what you've missed in the first 6 months was getting to know this couple, getting to know who they are, getting to know their sense of humor, getting to know how they have typically navigated their situation. And by the end, we see Amanda, who is really shifting her role completely. Betsy, thank you so much. You can go ahead and let that play out in whatever way you wish. What I want to tell the audience at this point, though, is that one of the reasons we love these short plays, our shortest is about 15 minutes. This one's about 18 minutes. Our longer plays are 45 minutes, but we take a shorter play so that we can harmonize the audience's experience. We can help them be in touch with a story with some individuals. In one case with Fortune Cookies, it's a mother and son. With Riding the Waves, it's a mother and 2 adult children. With In the Garden, it's a father with 3 adult children. Mango Songs is a young woman telling her story of memories that she had to reach back for after the time of her father's death. Each play offers both specific and general invitations into a conversation around what you're experiencing, around what your questions are. We would not have theatrical videos without the pandemic. I find it implausible to thank a pandemic, but as a stubborn theater artist, I know the power of live theater. So that is our preferred delivery method. However, thanks to the Minnesota State Arts Board allowing us to reallocate those funds, we did lean into how to create something we call a theatrical video, where it feels, our goal is to feel like you're sitting in the front row of the theater as you take part in a theatrical presentation. What happens right after watching the play together is we offer some brief instructions. Betsy's going to show you an example of the small group etiquette, and then we're going to put you into a small group for just a few minutes. So we give an introduction to what we'd like to see come out of the small group. We'd like small groups to be about 4 people, no more than 5, no less than 3. And we want people to take a moment to just quickly introduce themselves. Just their name is fine. We want to reinforce that there's a leader in every chair. And even if someone's not ready to speak, they can pass and we'll give them a chance. We'll come back to them. But for those moments together, it's like a small coffee chat, a chance to be together in a small group and answer a question or two. We ask them to listen for shared insights and to jot down their takeaways, because when we come back together, whether that's the main room virtually like we're doing now, or in a large group debriefing in a live audience, we're going to hear popcorn style from the room, and we're going to answer those questions and respond to those comments in real time, again, with those subject matter experts in the room, so that we have kind of the best of a social learning experience. I'm looking at one comment here that's so great. I'm sure I wouldn't make it through the whole play without crying. Thank you for that comment, because there are so many experiences, and we are always also on the watch for that. Has someone been so impacted that they're feeling like they need some extra support, or a chance to like stand up and walk around? And I want to tell you one of the most beautiful things, again, over 330 events we've delivered, the way that community supports each other is so beautiful. It's become so predictable, and it's one of the very magical parts of this project. So we're going to put you into a Zoom room with 3 other people, probably 4 people per room, and we're going to show you some questions in just a moment. What I'd like you to do is focus on the question that's about thinking about Amanda as a caregiver, the kinds of concerns you might have for her as a caregiver, the kinds of hopes or advice that you might have for her. But it's your breakout room, so you can talk about whatever you want. And Betsy, I'm comfortable with giving them like 6 minutes. It's not much time, so do your best to have everybody just like talk about any concerns they have for Amanda, or advice they have for Amanda, and then we'll give you one demonstration of what it would be like to come back for that debriefing, and we'll be moving quickly. So go away into your small group, focus on the questions about your concerns about Amanda or any other caregiver, and advice that you have for them. Go away, and then Betsy will bring you back automatically. There they go. Yay, good job. It's all happening. Okay, great. Thank you. And then we can take that away. Okay, great. Sorry. So with Louisa and Kimberly and Pablo, I wonder if we can get them into a group, or if you want to facilitate.
Yeah.
Oh, there goes. Okay, great.
Louisa, I'm going to place you in a room. Kimberly, I'm going to help place you in a room.
Hi, so for Kimberly and April, we're going to presume that it might be difficult for you to get into a breakout room, and you can either respond in writing, or if you want to unmute. I'm just curious about those little excerpts that you saw. What kinds of concerns would you have for Amanda? What kind of advice would you have for Amanda as she is on this early stage of a dementia journey with her husband, and she's in this new role as being a care partner? And if we don't see you unmute or type, I'm wondering if Betsy or Ashley would want to answer that question. Hi there, Dawn. We're actually taking on a question. I'm just going to ask Betsy to respond to that question of what advice might you have for Amanda in this kind of situation? And again, you can use the chat if you'd rather put in your advice to Amanda, or any concerns that you might have for Amanda. Betsy?
Yeah. So what advice would I have for Amanda? Self-compassion and self-love, continuing to find those pockets of resources that are out there, and having that moral support, that loving support, that nurturing support from a trusted confidant. It's just so helpful, as I have come to know, how helpful it is to be able to talk about what I'm experiencing as a care partner.
Betsy, thank you. The reason you probably already know why I asked you first, because I know you need to pay attention to the breakout rooms. So you go ahead and communicate with them, and I'll bring Dawn, Catherine, and Diane and Kimberly up to speed. So we're just treating this main room right now as a breakout room of our own. And so you can type into the chat if you would like, or you can unmute and share your thoughts. But I had asked the breakout rooms to focus on any advice they might give Amanda or any concerns they have for Amanda. And so thank you, Betsy. That was really, really important, to be able to think about self-compassion and to know who your people are. Who can I talk to? Who can I talk to very openly and honestly about how I'm feeling today, or in some moment of celebration, right? There's the highs and lows that go with the journey. I think when I think about the character Amanda, who I've known since like 2012 or 13, when I first read this play, when I think about the character Amanda and I think about concerns I have for her, I get concerned that Amanda won't know which ball she needs to put down. She's a busy grandparent. She seems to love her work. She's very engaged in her travels and her connections with her own social group. And, as dementia progresses, and we don't know much about what's going on with Tim. We just know it seems like things are moving pretty quickly for Tim. As dementia progresses, there's a bizarre thing that happens with time, and that time just seems to be stretched thin all the time. And it can be so difficult to know which ball to put down at any time. So as Betsy said, those people who are confidants in our lives, those professional resources, they can all be helpful to us when we have an important or difficult decision to make, about which ball to put down, permanently, temporarily. So yeah, Betsy just gave a warning. And when will they be coming back, Betsy?
Any moment. There's about 15
moment.
seconds left.
Okay,
Yes.
great. So I'll be watching as they get ready to come back, as everybody gets ready to come back. And then we will do a very, very brief example of, did you say close now, Betsy?
Yes.
Okay, great. We'll give a very quick example of the community debriefing. So it's all so difficult when I don't know for sure. I should probably not co-host. Hi, everyone. Welcome back. I bet that might not be extremely satisfying to have such a short conversation. Hi, everyone. Welcome back. Betsy will let me know when everybody is. I think they're all back now.
Everybody's back.
Yeah, welcome, everyone. Welcome back. I'm sure it's not super satisfying to have such a short conversation, but we wanted to give that example to you of what it's like to just go into that breakout room and have that short conversation. And again, I asked you, but it was your breakout room, to think about what advice you would give Amanda, or what concerns you have for Amanda. And I'm going to ask you to put into the chat some of the things that came up in your breakout room. What were you thinking about? What did you hear from your colleagues about the advice you have for Amanda, or the concerns you have for Amanda? And I'm wondering if there's one brave person out there who would go ahead and share something, an insight or a comment that came from their breakout room. Betsy will help me find that brave person. Just go ahead and unmute, and whomever you might be. Hi. Danielle, you are unmuted. Would you like to share from Chicago?
Sure.
Yeah,
So
what advice or concern do you have for Amanda?
sure. So in my group, actually, and I discovered another colleague from the state, so which was great as well. But we were discussing a lot about, just concern around Amanda's level of understanding of like what's going to occur with the decline over time. Is she having an awareness of different strategies for communication, and as behaviors might shift, the aspect of his reality changing, because we were able to note that that decline was really occurring and it was visible. But also what type of supports, sometimes family may be in denial about things, and what is there, and what does she have in place to also support her, as her level of stress may increase if she's not really at a space of understanding, but also not knowing what to do next, because there are points where caregivers have no idea, like, what am I to do in this place? So a lot of factors there to consider.
So many factors. Danielle, it's almost as if you were a plant. You really answered. So this is why having a dementia care subject matter expert in the room is so important, because so often we don't know the kind of question will come up. We don't know the kind of uncertainty or experience that will come up in the room. And again, we get a chance to learn in that social environment. It's also excellent when we do professional development, and folks like so many of you get a chance to share your insights and your knowledge with each other. Now, just imagine for a moment how satisfying it would be if you were able to go into 3 breakout conversations with different questions, and each of those questions had 10 to 15 minutes. It's an incredibly rich and powerful experience. And by the end of the community conversation, we have addressed so many questions and identified so many connections to resources. Plus, people are then ready to also connect to other resources that are available to them. In a live in-person viewing area, it's usually a resource table, 1 or 2. When it's virtual or hybrid, we're providing information electronically right away afterwards. So it's a really, really powerful example of coming together, building community, learning together, sharing, and deeper connection. And again, with a caregiver that we are able, a fictional one on the stage, we're able to talk about Amanda, as a role model. Like, what could and should Amanda do? What might Amanda do? What would be our concerns? And it's just an exciting way to be learning together. I'm looking forward to reading through the list. I'm going to turn it over to Patty right now, or turn it over actually. Who should be leading this, right? I bet it's Elma. We'd love to take questions, whether that's for Minnesota Department of Health and their amazing BOLD initiative. We're taking questions via Zoom. And also, I think we'll watch for hands raised. So I'll help in whatever way I can. Patty, Elma, Maya, Betsy.
Well, you already teed it up very nicely, Danette. This is, we have about 20 minutes left of this session, and thank you so much. It was so great. It was the first time I attended one of these presentations, and it was amazing. I just wanted more, really. Usually, folks, attendees, please invite you to put your questions in the chat so we can take them one at a time, for either Betsy, Danette, or Patty today. So feel free to do that, or raise your hand to ask your question if you would like. Maybe very briefly, and so we can have more. Miss Anne, you have your hand raised.
I would like to know if you've done anything like this for older adults who do not have dementia, but may have other mental health concerns.
One of the plays that we use now is called Fortune Cookies, and the character in that play probably does not have dementia, but she's among the worried well, and her anxiety about dementia is really high. The play is actually pretty funny in most of the places, because she's got this big idea for how she's going to be the first one to know. The transition that I've seen in just 10 years to talk as much or more about brain health than dementia helps us talk more broadly about, again, other topics, mental health being a really important one, or more specific things, suicide prevention. So while the Remember Project, as it's known now, really focuses on dementia awareness, dementia education, and building dementia-friendly communities, our work with the Center for Creativity and Public Health is leaning into many other topics. So mental health, suicide, the environment, gun violence. So we know this model works, this model of using the arts, whether it's theater or some other art form, to invite an audience into a really challenging conversation, and then really creating that kind of sacred space together, whether it's live, virtual, or hybrid, so that we can have those conversations. That was a long answer to
No,
say yes.
thank you. I appreciate that. Thank you very much.
You're welcome.
Thank you. Thanks, Miss Anna. Thank you, Danette. I actually do have here comment. I thought it would be a good opportunity for Patty, for you to maybe speak about how public health, how our BOLD program has approached this in Minnesota. From Miss Jane Grunt at 11:57 in the chat, for if you would like to take a look. It's kind of rather of a long question, but it's really about how do we don't just diagnose and adios, as right as often is the experience. How do we, the role of public health, what can be done, what have we done so far, what are our plans to give the tools and resources to support our providers from the moment, from the primary care setting, and even before they're in the community, how do we support detection in the community and afterwards as well? Maybe
right.
Patty,
I read this comment, and it really sort of sums up the public health issue really well. So I'll just say that this is a really common experience. I would say it pretty much is the experience, that it seems like newly diagnosed or families dealing with potential cognitive decline experiencing. So there's just this tremendous amount of opportunity to improve these like community clinical linkages, or what we call it, so one of the things that we're working on with our state, we talked about that Healthy Brain Partnership group. That's sort of, this is like the Alzheimer's Association and the university and our Department on Aging. And so like all of us collectively together are trying to identify what is like the ideal framework for when someone, a caregiver, a family member, a person experiencing signs and symptoms of memory loss, when they're, we're trying to build that support in the community so that there's a trusted, entity that they can go to get support. And then ideally that trusted entity can refer them to someone who has some specialized skill and training in this area. And ideally that person can refer them to primary care. And, and then ideally the primary care provider knows what to do next. And there are huge gaps in each one of these steps that really need a ton of attention, way more public health funding. So, I mean, some of the initiatives are around age-friendly healthcare, and within those, there's best practices around like identifying the caregiver in the electronic health record, so that the providers are actually focused on supporting the caregiver, their health and well-being. Making sure that when there's a diagnosis or possible diagnosis, that the care team knows what the community resources are and is able to refer, and not just, these big phone numbers for the Alzheimer's Association, but, really what are some tailored services for this family that are meeting their cultural needs and other social determinants of health, issues that they may be facing in addition to the diagnosis. So I think it just really encompasses our work, the direction of our strategic planning, and our community partners through these MDH Healthy Brain community grants. Like, these are the kinds of things that they're working on. They're trying to educate caregivers to find those services, build the relationships with primary care to be able to communicate when they have a family that needs support. And then I had a question for Danette, which was, can you say more about how you're working with community-based organizations in Minnesota on theatrical performances and what that's looking like?
Yes, and again,
it's so exciting.
Yeah, it really is. It's exciting for us too. And again, there are people in the audience today that have participated. And if any of them would like to chime in, please let Betsy know. I'm not doing very well watching everything that's happening on my Zoom screen right now. So typically, no, there is no typical. I said one size doesn't fit all. So I'll give you an example. The community of Granite Falls, Minnesota, was aware that we were doing these theatrical videos. And so they organized with several nearby communities, they organized a coalition of dementia-friendly communities champions to create a partnership with us, so that over the course of about 15 months, if I recall, we were able to deliver several virtual programs. This was started during the lockdown, actually. Maybe the first round of vaccinations had been available, but so some of our first touches to their communities were virtual. And then I think it was the summer of 22, it might have been the summer of 23. What's happening with time? We went out and, we went out and did some live events at a couple of different venues in that region. And by working together very carefully, we provided a lot of marketing material so that they could help let their community know. We helped provide them best practices advice. So they were so ready. It was really fabulous. And they're like all of our other partners, they just all get ready in different ways, right? So during an event, they stand ready with resources. They stand ready to make immediate connections during and after the event. And they turn it into an opportunity for building communities. So the first part of those in-person events, we usually have 45 minutes of social time. Usually it includes a meal or some kind of gathering time. Then we watch the play together, and then we go into a community conversation. We're doing another version of that in Northfield in the fall and over the winter. Again, a combination of some in-person visits and some virtual visits. So, we build these based on a common framework, but we customize them based on the needs of our community partners. In some cases, there's fundraising that's needed to be done to help pay for the expenses of an event. And we even help provide those that support if there's grant writing assistance needed, or language that's needed for a support, like a corporate sponsor or something. We try to really support in every way possible, because we know that those of you who are working on the ground in your communities, that you are carrying a lot. I mean, my experience is, and it's not only in this topic, environmental protection is another great example. There's probably never going to be enough money or paid staff to reach everybody in a timely manner. So we need the community, we need stewards, we need individuals to be aware and be ready to share their knowledge, because as most of you know, when a family is encountering this diagnosis, day one, I mean, a lot changes and then nothing changes, right? I mean, that's still your loved one. This is still your household, your family. And so we have something new. We have new information to deal with, which is not the same for every diagnosis. So it's a lot, and we all know it's a lot. And that's what we try to do. We try to help build a compassionate space, really in direct conversation with those communities, so that we can be better together.
Any other questions or comments? Anybody for our speakers today? Thank you, Danette. Such a good answer. It really takes a community.
It does.
Yeah, absolutely. There are more messages here in the chat. I don't know if Jane Grutt is still online or not, but I hope we answered the question. And I see that Maya also posted a response.
I am.
Yeah. Did we answer a question? Would you like to discuss any more?
No, I just think that I'm in the West Metro of the Twin Cities, and there was nothing for us. This is 2016 when my husband was finally diagnosed, but he and he was already in the late stage, which is,
Oh.
you know, they missed his diagnosis. And family meeting took 5 months. We were told, come back in 2 weeks. That was the soonest we could get in. This was at the University of Minnesota. And there just was nothing for us. And now daycare services for adults, I didn't even know they existed. I'm an RN and, you know,
Yeah.
didn't know they existed. And now they're called adult services. So we all assume now that it's just for low income people. And it's services of social work, you know, getting expenses paid for groceries and food. And so the changing of the name was just one of the horrors. As I go out and speak now, because I do have my book out, my bridge was collapsing. And that there are people that don't even know that Medicare and Medicaid don't, you know, Medicare and insurance doesn't pay for nursing home. And so there's just so much ignorance, and no caregiver is going to bite on the bait when they can't see the bait.
Yeah.
So.
Yeah. Thank you. Thank you, Jenny, for sharing that. That's actually the very reason the work of BOLD is really to create that public health infrastructure, to build those connections and in 4 different ways, by building the workforce, educating all of us, educating the public to raise awareness, using the data, and where do we get it to know where do our community members who live with dementia actually reside, who are their caregivers, who are supporting them, etc. And that is to wrap around healthcare itself and to extend that dementia care into the community and that support system. And that's kind of the goal of all of our work collectively with the BOLD program, is to extend the infrastructure to integrate health care and social services to find that support, to build that in each state. And that might look different in each state. It's finally, it's been after decades of work in the last 10 years, it's gained a lot of traction. For example, in the healthcare space, I don't know if you're aware, Jane, the new guide model. It is a new model, a payment model for comprehensive dementia care that for the first time really includes services also covers services and support for the family caregiver, and centers a role of a care coordinator, navigator, somebody who is going to walk with the family and with the person living with dementia throughout the continuum of care. It is really to create a more comprehensive approach to how we care for our communities living with dementia.
And there's models in other states too, not very many, maybe 2, but like Wisconsin has a memory screening in the community program where there's dementia care specialists who actually are able to do community-based memory screening. And then it's also connected to memory care clinics where they have a social worker who you know, identifies the needs for the family. And that's a state-funded system that we don't have in Minnesota, but I think just, you know, really continued advocacy among all of our partners and community members and coming together collectively in the space is how we'll make something like that happen. And, you know, the Wisconsin model is a good model. I don't know. If it's the best model, there's not a big evaluation of that model that we can talk about yet, but I'm confident that Minnesota would build an awesome model if we had the resources. So just a push for, you know, continuing to like show up and have your voice heard in different spaces about what you've been through and what's needed, you know, on the clinic and community side to support families.
I would like to.
Oh, go ahead. I was just going to ask one really quick question of Danette. If we wanted to get something started like this, I'm in Utah. How would we go about? I don't see on your website anything that you could enroll in a training or a conversation or whatever. How would we go about doing that?
I'm going to make sure that Betsy puts her contact information in the chat right now. We've got several statewide models that we've worked on with other states. Michigan and Ohio are the 2 more recent ones, but Minnesota and Wisconsin, most of our events have been in these 2 states, and they are 2 very different systems. I wanted to piggyback to what Patty was just saying, and Elma, you know, those of us who do not work in public health our voices about what we're seeing and the excellent work that's happening and how resources will help us do better, our voices really are needed. It's quite amazing, like in Wisconsin, to have a dementia care specialist available county by county. In Minnesota, the great integration between different kinds of systems and these efforts to really work in true partnership. We need to applaud these things and celebrate these things and make sure that these excellent public health workers are, stay in place and are valued as much as possible. This continuum of care, again, it's different state by state. Every state handles their older American Acts dollars differently. If they are getting bold monies, again, you are expected to have a local or a statewide plan. So that's one thing that we try to do with our program, is be really attentive to the differences, those very specific measurable outcomes that you are all working toward. Betsy and I love logic models. We we take it very seriously that yes, theater might be seen as floofy by some members of the community, but actually for centuries, theater has been a teaching tool, a learning tool, an engagement tool. Sometimes you need to go through the heart to get to the head. And I want to tell Jane, that title of your book, My Bridge is Collapsing, what an incredibly powerful metaphor and title. We've seen so many families who are in that place, and things are better now, I think, from what I've seen just in 10 years, quite a bit better. And we've got a ways to go. So if you're representing a different state and you want to learn more, we are very happy to be in conversation with how you might do something small, medium, or big. Yeah, we'll help you.
Thank you. Thank you, Dana. Thank you, everybody, for this great conversation. Thank you, Ms. Jane, for sharing your story with us today.
Yes.
But really, it's those
Thank
stories
you
that
so
drive
much,
all of the
Jane.
work that we do. Thank you to our presenters, Patty, Danette, Betsy, for being here with us today.
Thank you for letting us
just about
share.
2 minutes left for any final words, if you would like to share or say anything. Well, thank you. This has been great. I'm so happy that we can highlight our work in Minnesota and the work of the Remember Project. I hope it continues to spread and grow. It is really powerful.
Thank you.
Please let us know
Thank
about today's
you.
experience. We really, really take it seriously to heart, and we use it to improve. If you have just a couple of minutes it shouldn't take more than a minute or so to complete the survey. Thank you again. Hope to see you soon at the next installment of our series, which is coming. It's going to be New York State in August. So stay tuned.
Thank
Take good
you.
care.
Bye,
Bye.
everyone.